welcome to a higher branch. And we are recording this interview at the All Saints Skin Clinic in Double Bay, Sydney. Very excited to be presenting this week's content to you because I think it's going to have a dramatic impact on your life. We're going to be downloading some very valuable information. Now, you all know I place a very heavy emphasis on emotional well-being because it drives our thoughts and drives our physiology. But have you ever considered what the impact of your face has on your emotions? I believe that it impacts our health, our relationships, and as my guest would say, that a tranquil face attracts people. And I think it also attracts success. So we're going to be talking about things like how to take care of your face, the true causes of face aging, and a whole lot more, including intervention, because that is something that we should consider. We should not be turned off by some of the things that we see, the unnatural things we see out there, like fish lips and Botox faces. I want to introduce you to our guest, Dr. Joseph Hkeik. And we have a lot in common, Joseph. Both our backgrounds are from Beirut, Lebanon, but Joseph is an aesthetic physician, and he has a Bachelor of Medicine, a Bachelor of Surgery, and is the former Dean of the Medical Faculty of the Australasian College of Cosmetic Surgery. On that note, Dr. Joseph, welcome to our community.
Thank you so much, Sam. Pleasure to be here with you.
I'm really excited to be presenting this information because I have not heard any interviews publicly about this space. And we all have heard the cliche, beauty is in the eye of the beholder. But I think the number one beholder is the person that looks into the mirror first thing in the morning.
Absolutely.
And I say that because I have a 17-year-old teenage daughter, and I can see her psychology for the rest of I can predict her emotions for the rest of the day about how she feels when she first looks into that mirror. So my first question is, what is beauty, and why is our face so important to our feelings?
Well, I can talk about beauty for hours, and I'm not going to just talk about beauty because I know that you have other questions to talk about. To me, a beauty is about tranquility. It's just about having a balance, having a peaceful face that when you look at, it draws you in. More than really having beautiful features.
Yes,
to me, it's just about that peaceful features on your face that draws you in, and invite the people that want to really get drawn to you and want to come closer and talk to you and get to know you.
I love that because most people are obsessed with saying, I want a beautiful face, but a beautiful face is not necessarily, perfect symmetry. It's peacefulness, it's tranquility.
Correct.
So there's a connection between your face and the emotions, what's going on inside you. So I really love your approach. That's why I sought you out, and the more I found out about you, I became extremely fascinated because you have a background in art and sculpting, and you see the face, as a work of art.
It is, and to me, every face is beautiful. And often with what I'm doing my work, I'm trying to see what is taken away from that beauty of that face. And I want to replace what is missing, and not to actually get too creative and create things that don't belong to that face, or to change it completely that people don't recognize the person behind that face.
Yes.
So this is very important to me. It's very close to my heart, is to keep the identity present and not to get rid of people's identity for the sake of giving them the perfect lips or the perfect cheeks or whatever it is that they've seen in a magazine. It doesn't work with me in this sense.
Do you get people that come in with a magazine and say, I want that?
Look, I used to. When I first started, I guess everyone probably being approached by these magazines that people come with Angelina Jolie's face and says, I would like this jawline, I'd like those lips.
Yes.
But I think as I've established myself in the industry, and not only here, but I teach worldwide. So people know about my philosophy, people know about my reputation, that I would not contemplate these requests. I work with people to elevate their beauty. I don't work with people to change their beauty. So for me, it's just trying to find what it is about this individual that is stopping them from becoming the person they're destined to become. And then trying to remove all those barriers from their faces, because they look at their face and they're getting messages. I try to understand what are these key messages that they're receiving every time they look at their faces. And I help them to break down through those barriers to get forward in life.
Wow, that's very powerful. In a way, this therapy.
Well, it is, at the end of the day, I'm still a doctor and I practice medicine.
Yes.
So I am counseling people. I mean, the longest time I spend with my clients is in this chair, talking to them about their concerns, watching them look at their face in the mirror,
Yes.
seeing where their eyes are drawn. Sometimes people don't want to talk about things, they're too shy or too embarrassed. I'm looking for all those clues in the conversation to really tap into their heart and tap into their mind and understand what it is that they're seeing. And I guess being a doctor, you kind of have the intuition about understanding where all these fears and where all this negativity coming from. And then my job is just really through my skills as a sculptor, to change their face only to actually improve their perception of themselves and not to really give them this outrageous look that people are scared of in the community.
Wow, that's really powerful. Now, I do want to talk about, I want to stay on this, but I do want to also talk about the true causes of face aging, the importance of the bone rather than the skin, and lifestyle factors like how the impact of stress, sleep, and sunshine has on face aging, and maybe food as medicine, supplements, all those things. But I want to stay on this emotional element of what you do for people, because I find it powerful, because some people will spend hundreds of hours, thousands of dollars in a psychotherapist chair or a psychologist chair, right? But you can transform them in one session. One session.
Yeah, one session really is.
I love that, because I love getting from point A to point B really quickly. We have limited time on this planet,
and we live in a fast pace. Really, I think I started to pay attention to this phenomenon from early days.
Yes.
And to be honest, when I first started doing aesthetic medicine, I got bored. I've got a history of getting bored with what I do on a regular basis. I can last 6 weeks in something and say, oh no, I've mastered that. This is too boring. Let's move on.
True source of genius. This is what most geniuses are like, right?
But there was one time where I think I just realized the impact of what I do on my client's emotion. And to be honest, this is what gets me going. It's not really the fact that I can make someone look 5 years younger, or I can make him worthy of being on the front cover of a magazine, because I can do that. It's not hard for me to do that. But I think it's just that emotional aspect of the transformation that keeps me engaged and keeps me coming back every day to work to do the same thing to new people that come knock on my door. And I look at the same people, year after year, because we do a maintenance program for a lot of our clients to make sure that we keep them looking their best throughout their years, whether or not they're in their 30s, 40s, 50s, or even I have patients in their 90s that still come to see me about maintaining their skin health and their look. But it's the emotion to me that is most important about what I do.
And what is the biggest transformation you've ever witnessed? Do you have some stories for us?
Well, look, I do. I mean, I do have. I can try to make it brief, because it's probably one of the stories that made me realize that yes, this is for me. And as I said to you, I was swapping and changing. I do things for 6 weeks to 8 weeks, and then I said, no, this is not for me. So I've done every specialty in medicine you can dream of, and I've tried it, and I said, yeah, this is good. I can do it. I've done it. Tick the box and move on. At the early days of my career, this lady came to see me. She was a 76-year-old lady. And then I won't say her real name, so not to identify who she is.
Sure. Yeah.
But I'm going to call her, for the sake of the story, Anne Smith.
Yes.
So, and I normally just go to the waiting room, say, Anne, please come to my office. And she looked at me and said to me, I'm not Anne to you. I'm Mrs. Smith. And I said, oh my God, this one's got attitude. But okay, I'm just going to take her in and just listen to her story. Everyone's got a story.
Yeah.
Her story was that she's been to so many practices. And then she doesn't want to do surgery. She was very flat in the face. She really looked more than 76 at the time.
Yes.
And she said, I don't want to do surgery. Is there anything you can do for me non-surgical? And that will make my face better. And I said, looked at her face and said, look, I can.
Yes.
And he said to me, are you sure? And at that stage, I'm feeling quite uncomfortable, because she's putting a lot of pressure on me.
Absolutely.
She's got attitude, and she's just got this not one smile in the whole consultation. Yeah. And I was tossing, do I keep her in as a client, or do I just take the easy way out and just say, you know what, I probably cannot help you. And I said, you know what, I'm going to take this challenge. So I said, yes, I'll make you better.
Yes.
But I need to see you 3 times, once a month. I'll see you every 4 weeks. And after the 3rd visit, we'll do an assessment. So I did. I brought her in the first month. I did the session, sent her home, came back. And then on the 3rd visit, when she came back for follow-up. So I've seen her 3 times. She came back for the follow-up. And then when I went to the waiting room and I said to her, Mrs. Smith, please come in. She looked me in the eyes with a big smile and said to me, I'm Anne to you now. And I said, wow. And I said, that was a moment really where I almost could have cried in that moment, because I thought, I can sense something really shifted in this person. I can see that she's smiling for the first time. In 3 months, I never saw her smile. And I thought, oh my God, she's probably coming to complain today. But it was complete opposite. That came just like a wind from the wrong direction and hit me in the face. Said to me, you can call me Anne. And then I took a picture, and that picture often I share because she allowed me to share it in the magazine. And so I share this picture with people, and they can see the transformation. And it was not the physical transformation that was obvious in that picture. It was just the psyche. Like you look at her eyes, she had a smile. She was happy. Yeah, she just basically she reconnected with her personality. While before she was disconnected with her personality. And I felt that by doing my physical transformation, I was able to really bring back the inside together as well. And all of a sudden, things make sense in her life. And so that was a moment in my life where I realized, this is what I'm here to do. It's not really just about focusing on the physicality, but just to actually understand more about what's happening inside and their heart and their mind, and trying to connect everything, through some subtle changes that I can easily create on the outside.
And so we all have Anne Smith to thank for your continued thought leadership in this space. Now, your patients, or your clients rather, are getting younger and younger, aren't they? What's the percentage between male and female, just quickly?
Look, at one stage, if you'd asked me when I was still working in the Darlinghurst clinic before I moved here, I had about 45 men to 55 women.
Okay, it's a high percentage of men.
Yes.
That surprises me.
Yeah. Yes. Well, at the time, I never thought about it. It was just a patient of mine that said to me, my God, I've been to you. Every time I come to you, there's only men waiting in your waiting room. Right. So this is what got me really analyzing my database.
Okay, that's good.
And they were mostly businessmen from the CBD. Lawyers, doctors, barristers, you name it. They were all coming. Truck drivers, you name it. It was just like there's no category of people that were actually frequenting All Saints. Now, since I moved to Double Bay, because we have a medical spa in here as well, and I think we're attracting more of a younger generation. So the proportion of men to women has changed. And it's more like about maybe 30% men, 70% women. But I think the number of men that I was seeing is still the same, which is just that being diluted by the extra numbers of female that have come forward.
Now, going back to Anne Smith then.
Yes.
What was wrong with her face, and what were the causes of her aging or face aging that we all need to look out for?
Of course. I mean, look. Anne Smith was 76 at the time, and she really looked quite gaunt in the face. But basically all she was a skin and sunburn. Because even when you go through menopause as a female client, you'll go through some bony changes earlier than the men. The men will go through some similar changes, but maybe 30, 40 years later. So this is why men always look better at 40, 50, when women start to complain about their age.
That's true, yeah. I often wondered
men
about
always
that.
Look more handsome when they get to 40, because as the changes occur, we accept that as more attractive because the face becomes more square. But when the women go through the same changes and their face becomes square, that is not acceptable in a society, because people feel, oh, your face has dropped, so you're looking more jowly. And jolly for a girl is not the same as jolly for a guy, because jolly for a guy makes you look more attractive. Unfair, I know.
That explains.
But this is the reality. With women, they go through bony changes earlier than the men. So with Anne Smith, she had some bony remodeling of her face. So she's lost the bony prominences of her cheeks.
Because it's the bone.
It's the bone
that influences our skin.
There are many layers of aging process. And when I'm looking at a face, I'm looking at all these layers. So I need the history. I need really the background, whether or not they've been through an illness, because that can also implicate the aging process. So we look at the bony skeleton of the face and then look and see how has it changed. I also look at the fatty compartment, which is also include the muscles around it, because we do lose fat in the face. There's fat pads on the face that usually when you're 20, they're full and compact, and there's no shadows between an area and an area. Everything flows so smoothly between the cheeks and the nasolabial fold and the chin. Everything makes sense to the eye. But also you have skin aging. And in Australia, that's a huge. 80% of our skin aging is because of the sun. And the sun here is terrible. It's not really designed for anyone who's got what we call Fitzpatrick 1, 2, or 3, which is Irish, English, and then, some of the Lebanese, Italian, Greek. We do suffer consequences of the sun. If you had a very dark skin, Australia would be a great place for you. But unfortunately, we all live here, and then we're all exposed to the element in our environment, and that affect our skin. 80% of that damage is because of the sun. And this is why I think prevention is important. You mentioned that word before. I love that word, to actually talk about prevention.
Yeah,
but
absolutely.
for Anne,
yeah.
was all the layers of her face has been affected. The bony structure was affected. She had no fat left on her face. It's all been deflated. And then her skin has already started to become wrinkly and weak. And then there's no elasticity. So to be able to help her, I needed to understand the causes of what caused her problem.
Yes.
So I can fix the cause and rectify the total look of her face. Because I understood that, I was able to deliver results to her.
Beautiful. So what are the causes of that impact the bone, the fat and the muscle, and then lastly the skin? I mean, I'm guessing with skin it's sunshine, but if we start at the bone.
If you start at the base, the bone is if you like, it's the column of a house.
Yeah.
So it's what really keeps the roof standing there. If the column of the house really disappears, the roof will fall.
Yes.
Bony, luckily for us, bony changes occur later in life. So for women, that could mean if they have a bad menopause that's not being managed correctly, that can happen at 40s or 50s.
Right.
For guys, it happens much later, maybe 50s and 60s or 70s in some cases.
Okay. Yep.
So this is an aging process that we all go through. And we all go through these changes. We all go through it at a different rate. So some people might age at 50. Some people might not age till 70. And this is why you look at some people and say, I can't believe you're 50 or I can't believe you're 70. Because they've been blessed with that genetic that their bone hasn't really changed.
Is it just genetics or is it something that they've done? Is it what they're eating?
That's the biggest factor.
Yeah.
The second biggest factor will be really, of course, nutrition is important. Your lifestyle is important.
Yeah.
How much rest, how much nutrition, supplement you take in. But also if they've gone through any illnesses. Certain medical condition, for instance, cancer. If you go through these things, it can affect your
of course, your bones,
bone density.
Your bone density, yeah.
Yes. So all these factors can affect it, and this is why it's important for people out there to seek a doctor's consultation the first time they go on this journey, and not to take shortcuts. Don't go to backyard. Because all they're doing is fixing a little tiny bit for you. It's not going to change you. It's not going to change your life. All it's going to do is just, it's like a Band-Aid solution for 1 week, 2 weeks, and then you're back to square one. So a medical consultation to me is very important, even though we look at it from an aesthetic point of view, but it's really a medical procedure. It's a medical consultation.
Of course,
so it's very important to me. I don't agree with people taking shortcuts for these things. It doesn't help them in the long term. So boning is the first change.
Yes.
The second thing we do is a soft tissue. And a soft tissue really constitutes of the fat pad, of all the musculature of the face. As you know, with age, we all lose muscle tone. So the muscle will become a little bit more relaxed, if you like. They're not as full. And also they become a little bit longer. So, your facial musculature does not hold you, it doesn't help you to stay up.
Yes.
So it starts to become saggy. But what contributes more to that than muscle is really the fat pad. Now, fat pad, some people are prone to actually be skinny all their life, and they cannot really maintain fat anywhere on their face or on their body.
Yes.
More so, people that always forever trying to lose fat from their body, the fat of the face is more sensitive than the fat of the body. So they end up losing more fat from their faces. Now, I see that often is, and not bony changes, mostly fatty changes in young people that are forever trying to get six packs, or women that are trying to be flat tummy all the time.
That's why I laugh, because I took up long distance running a few years ago, and I always had this fat baby face that I hated. Right. But as soon as I took up running, I started seeing the
changes,
the jowling, as you said, and I thought, oh, I like this guy.
Yes.
But now, as you get older, you think, well, maybe I want to go back to that fat,
Well, I always say in this case, keep to the exercise, and it's only going to take you 15 minutes with me to actually fix it up. So look after your diet, keep exercising, come and see me once a year for 15 minutes, and we can just keep you looking the same. but fat loss is more important, I think, in the younger generation that are trying forever to maintain a slim body, slim look, or more importantly, that six-pack look. Every man, I think, in the universe right now is aiming for that look. And then that comes with a price of losing your fat pad and make you look a little bit, if you like, gaunt.
Yes,
And then,
but that's the look. Everyone loves that gaunt, chiseled look, as they say.
yeah, on the body it works, but on their faces, I think eventually a lot of them start to complain because they can see the dark circle under their eyes. They can see this big groove that travels in the middle of the face. All of a sudden, their temples sink and they start to look like a 70-year-old person.
Wow.
And you know, like I've taken, I mean, when I'm teaching, I always take model to my sessions. And once I took my trainer, who was a 36-year-old model, and then he came on the stage wearing a singlet, and you can see every definition of his body.
Yes.
And when I asked the questions, what are you going to do for this person? No one in the crowd wanted to touch him, said, no, he's perfect. Because immediately when they look at his body, they say, well, he's got a perfect body, so no one paid attention.
To the face,
so I said, okay, lift your eyes up now, guys and girls, lift your eyes up. Look at his face. This is what he's here for, not for his body. And so I just showed them that in someone at 35, I could easily put 9 mils of filler in his face. 9 mils is a lot of filler. This is not just a simple. Generally speaking, we put 1 or 2 mils. Sometimes we do 4 mils. But 9 mils is a lot of filler to give to someone at 35. And I showed them that it's this series of exercises or seriously exercising on a daily basis can do to your face. And I was able to rectify all these signs of aging on his face and then made him look about 10 years younger. Not that he needed to look 10 years younger in the process. But yeah, exercise, severe exercise can do that to you. So is any illness. Cancer.
What about saunas? I often wondered when I go into a sauna, I sweat a lot.
Yes, sauna can dehydrate you, but it doesn't help you to lose any of your fat. So your skin will look a little bit sort of, if you like, wrinkly after the procedure. But once you rehydrate your body, that will actually rectify itself. This is a short-term thing.
Can it be good for you, saunas, for the face?
I'm not phased. I don't think it's beneficial. I don't think it's really negative to your face. For your body, yes, you'll feel better because as you increase the heat in your body, you bring in the circulation closer to the surface. So yes, your skin might look really rosy after the procedure. You might look pink in the face, but it's not going to really, I think, improve your skin quality.
So what does stress, what role does stress play? Because at the moment, at the time of recording this, having this interview, there's a lot of fear and panic out there about the threat of a coronavirus and what's going to happen to the world, recession, gloom. Everyone's stressed. And what I'm noticing is that's a much bigger side effect than any cough or fever or even pneumonia, right?
You mean, I mean, it's got 2 effects really. Stress does increase the aging process because your body will secrete different series of enzymes and hormones in response to stress. You know, your cortisol level is going to be going up.
Absolutely.
And then so you start your body behave differently. When you're under stress, also you don't tend to follow your routine. Like you don't eat well, you don't sleep well, and then all these things also can affect the aging process.
How does sleep impact?
Well, you know, when
your face aging.
Yes. Well, when you're sleeping well, in the middle of your sleep, in the rapid eye movement phase of your sleep, your body secretes all the good juices that your body needs to repair and rejuvenate.
Right.
When you're not sleeping, you're missing out on the secretions of this special hormone that your body needs to repair itself. This is why we sleep. And so when you're missing out on all these hormones, your face is going to suffer. Plus, when you're not having a deep sleep, you know, wake up in the morning, you're tired because nothing's working in your body correctly. You need your good sleep. And so it all can affect you. And then chronic sleep deprivation, you look at people that haven't slept, you notice it. You notice
Absolutely.
the fat doesn't survive. The muscles are a bit more lax. Their skin a little bit dehydrated. So it does make you look more tired.
Wow. Okay. So sleep is very important.
Sleep is very important.
In previous interviews, I've emphasized the importance of sleep as a superpower. So forget about vitamins, forget about even food.
Yes.
Your number one thing is sleep. And to get more sleep, you need to get more sunshine.
I agree. I completely agree. I think sleep is very important, very crucial.
With your clients, do you have any focus on diet, exercise, sunshine, the lifestyle factors, supplements? Do you believe in those things?
Absolutely. No,
what sort of things should we be doing to prevent?
For me...
Besides not exercising as much.
No. I'm not saying you don't exercise. I'm a big exerciser. I mean, that doesn't show at the moment. Because
you look great.
I just came back from Paris in January. And I think when I go to Paris, I let myself loose. So when I say I let myself loose, I eat every croissant that comes across my face.
That feeds the soul though, right?
Exactly. Yeah. That's the only time I eat croissant. So I make up for the whole year.
Yes.
The question was about supplements.
Lifestyle changes,
supplements. For me, skin health is about 3 pillars. There's 3 pillars that affect your skin health. One is your skincare. So it's just what you put on your skin.
Oh, of course.
But also
topically,
but what you also inject in your face. So this is, in my practice, I have 3 departments, if you like.
Yes.
I have the department of skincare, which is what we prescribe to your skin, what treatment we do for your skin, what we inject into your skin or under the surface of your skin to rebuild your face.
Yes.
The second pillar of that for me is nutrition.
Yes.
And then I do work with a nutritionist in-house. She's a Wesker, who's an amazing consultant who does nutrition, supplementation, but also she's a skin consultant. So her background is skin and she studied nutrition. So she knows how to marry the two. And she knows when she sees someone, if their skin condition is worse because of a medical condition, how to fix that as well as address their skin concern so we can win. The last element of that is relaxation. I think very important to me that people are quite relaxed and calm, stress-free. Yeah. It's just no stress. Yes. So this is why a lot of our facials that I've designed for this practice here, they have these three elements are included, because before the treatment, we give the people a drink or a protein ball. That's not just a simple protein ball. This protein ball made with ingredient to improve their health. So they might have some probiotics, they have some protein, dietary supplement. Collagen, all this. We give them a collagen. Acid. We give them a collagen drink at the end of the procedure. So we supplement everything that we do. We cover it from all angles. And this is, I guess, why people find us, why we're popular really, is because we understand what it is that's making them age or have all these negative consequences of living, of stress. So we address all these every time they come to see us.
So they don't just have a procedure and leave. You actually make sure that they go with the complete holistic look at.
This is like a family in here. I think, when people come here, they feel like they belong, and people say that. And so they feel like this is their home and this is their family.
Well, it felt like that when I came in. I felt like I was visiting someone at home, and it's beautifully done. And your staff are impeccable.
That was intentional, because I mean, when you sit in the waiting room, all those books are my books. All the object that you find there, they're my personal objects. So I wanted to design it in a way so people coming to visit me and my team, and then to actually look after them, whatever that means.
That's beautiful. And you've sculpted some of these things as
well.
I have. You're a sculptor as well.
I have.
That's beautiful. So what are the top supplements that people should get into? Is it recently I started taking collagen, for example.
Yes.
But is there a vegan collagen? The other thing is hyaluronic acid.
Yes.
I'm taking that in pill form, but I understand there's also a topical form of that.
Yeah, look, I mean,
I took it for my joints, but I was told it also improves the skin, right?
But also you got to be careful, because not everything that we take orally will actually reach your skin. Other things that we take internally, maybe like a small percentage get to your skin. So the best way to supplement the skin, if you're worried about a condition, is to apply it topically.
Okay, that's interesting. I thought it was the other way around, but
no.
Okay.
Yes,
okay.
Not everything gets to your skin. Like a smaller percentage reach your skin. If it's something internal, yes, certainly orally will work better. But even sometimes topical application of hormone will reach your circulation much better than taking it internally, because your stomach, the acid in the stomach, break down a lot of the supplement. So this is why transdermal application of vitamin and mineral and then hormone, for instance, HRT, the best form is actually to rub it onto your skin. Testosterone for men, the best way to do it is to rub it on the skin, on a clean skin, non-hairy skin. You get much better absorption, and it doesn't affect your liver. Because you got to think of the side effect, not only the benefit.
That's right, the impact on the liver and the kidneys.
Exactly. So usually what we do in this practice is when patients or clients are coming to see us, we analyze their skin. We have a technology called Visa technology where we look at their skin and understand what is going on. So it's not just I look at their skin completely and then I make a decision. I confirm that what I'm suspicious of is scientifically true.
Yes.
And then once we diagnose their condition, we supplement according to their skin condition.
So it's highly targeted then.
Targeted, specific.
So it's not a one pill fits all.
No. It's not one-to-one.
I love that
so
approach,
even us
and respects the individual.
Yes, because I always say to my client, if you come to me and I diagnose you with high blood pressure and I give you a diabetes tablet, what's that going to do to your blood pressure? Nothing. And so I'm not going to waste their time and their money and their energy on giving them the wrong thing for their skin. There's a lot of things that we can give people for their skin. And there's a lot of supplement we can give them for their skin. But unless we know what it is specifically that their skin is lacking, there's really no point giving them one size fits all. So we everything's bespoke. Everything's just for the individual.
Yes.
And then we follow that. We chase the progress and we modify as we need to, because if we fix something, there's no need to keep giving you the same medicine. We look at giving you maintenance.
And do people then check in regularly with you?
Yes.
So it becomes a journey for life? Because I think a lot of people are not looking for one-off fixes. They're looking for a relationship for life these days.
Exactly. And it's like going to the gym.
Yeah.
You don't go to the gym for 1 month and then you stop and you expect your body to stay the same.
Yeah, good
Same thing with
analogy.
your skin.
Yep.
We need to maintain.
Yes.
If you want to maintain a good look, good healthy skin,
Yes.
you need to actually also, pay attention to that. Like any relationship, really.
Yes.
If you don't nurture any relationship, the relationship will fall apart.
Yes.
And your skin is no different.
Wow. So on the topic of love and relationships, the art of the face has always captured your imagination, just like it does sculptures, painters, and photographers. So when it comes to the two key areas of my framework, and people in our community would know what that is, the 8 areas of life, one of the key elements is love and relationships and its impact on defining who we are as human beings. Do you believe that the face is the most important feature of the body when it comes to attraction? Whether you're in a relationship or whether you're single, attraction is important, right? Because you can be in a relationship and not attract love and intimacy, right?
I have to say yes, 100%. I think it's the face is really what draws you to other people. It's like when you look at someone, you might think that you just admire that body, but really it's not the first thing you notice. And they've done studies on that. They've done studies on when people meet socially. What you really first notice is the eyes and the lips. And the eye will hover on the eyes and the lips before it starts to actually disappear and look somewhere else.
Yes.
So to me, and then even personally, I pay attention when I go out socially. I do a lot of experiment and just see what I'm doing. I just try to analyze myself.
Yeah.
I'm always drawn to people's faces. I mean, obviously this is an area of interest to me, but even when I'm not thinking about work and I meet people socially, it's just the face that draws me to that person. It's just that openness, that peacefulness, that, there's something about a tranquil face that really draws people in, regardless of their features. Doesn't matter if their features are big or small. It's just that there's something about each face, and the more tranquil it is, the more attractive it is.
So it's about being comfortable in your face, loving your face. And if you don't, then seek intervention.
Yes.
Yeah.
Yes.
But that's what it's about, really. It's about how you feel about your face. And I love what you said there about that the face is more important than the body, because at the moment there seems to be a shift the other way. During the Renaissance, there was a huge emphasis on the face, wasn't there?
Correct.
And the body was just let go. And then it was after a while Botticelli, realized the curves of...
Yeah, but look, really, this is about true love and true relationship. I'm not talking about lust. I'm not talking about people going to a party and just have something different in mind or different ulterior motive. I'm talking about true love and true relationship. What really matter in that relationship is the face.
So could you say then lust is the body and love is for the face?
It usually is that case.
Yes.
People that haven't really got true love in their heart, they would not actually notice a beautiful face, but they might notice a beautiful body.
Oh, wow. That is beautiful. That is a
They're the one that
quote.
need help. They're the one that need help.
Yes. So how does one know whether they're happy with their face? What are the telltale signs? We have so many things that stress us out at the moment in today's society, whether it's, financial hardship during, times of recession, or whether it's kids, or whether it's lack of sleep or too much work. How do we know?
Some of the signs or symptoms, if you like, of someone's not being content with their face. One, the easiest one is they don't want to be photographed. This day and age with having a smartphone in your hand, you think everyone will be taking photos of themselves.
Yes.
People that are reluctant to have their photos taken either by themselves or by their friends, often there's something stopping them from doing that. The other thing is when they look at themselves in the mirror and all of a sudden, all they start to have this negative conversation.
Yes.
Oh, I hate this, or I can't stand this, oh my God, I don't want to see this. And they're trying to hide some aspect of their faces. This is some of these simple things that people can often notice that they're doing. They don't put it into words. They don't actually try to understand why they're doing this. And then immediately they look at their face and they're not happy in the mirror, and then they start to think negative thoughts.
So it's about their face. I often thought that they're just shy introverts.
No, I mean, some people are.
Yes.
Obviously, we can't deny those people, because some people are introverted and they're too shy, and they might have the perfect face, but they have something else to stop them from going forward.
That's interesting. Is it that their shyness and introversion comes from their dissatisfaction with their face, or is it the other way around? That's
both
interesting.
Both are true.
Yeah.
Both are true. I think majority of people these days that I see in my practice are often, they look at their face and then get negative messages from what they see in the mirror.
Yes.
And then they're the people that I think are ideal, because you can just, if you pay attention to them and fix those negativity, the old perception of negativity on their face, the rest is easy, right?
Yeah, absolutely.
The people that already have beautiful faces and they're already getting negative messages, that could be a condition. Yeah, body dysmorphic syndrome.
Yes.
Because it doesn't matter what you do for those people. So the solution is not in my hand to do the work. The solution is trying to do counseling with them, or to send them to a counselor to actually help them see
the beauty,
the reality of their face, the beauty of their face, that actually there's nothing wrong with their face. And then letting them go on a journey of transforming their face to something that's not theirs is wrong.
I love that. It's that makes you a beautiful human being, that you that is your approach. Because have you had lots of people that come and see you and say, I want this done, and you say, well, I think you need to...
At the beginning, yes, I have. But I think I've done a lot of hard work at the beginning to train people.
Yeah.
Like, you got to train your patients and clients as well. You can't just really just accept everyone to come every time. So you set the rules, you set the, if you like, the expectation from day one. And this way, people know my philosophy, and people know that if they come to me, I'll spend the time with them, like a new patients, not much the existing patients, because they've already heard me say the spill. They know my philosophy. They would not come and ask ridiculous requests.
Yes.
Not from me anyway.
Yes.
And then if they fit within my philosophy here, they will follow my philosophy, and they will always make sure they look flawless and discreet. And by discreet, I mean they don't look like they've had anything done. This is what I mean by discretion.
On that point, one of the things that turns a lot of people off seeing sculptures like yourself, and I think it's a shame, because if you can transform the way you feel so quickly, then you should really consider those options. But a lot of people get turned off because they see people, walking the streets with these exaggerated lips and faces that just don't look natural. Why is that happening? Is it the practitioner, or is it the people forcing the practitioner?
I'll never blame the clients on that. I always blame the practitioner, because it's the person doing the procedure that has got the last say.
Yes.
No one's going to force me to hold a syringe in my hand and to inject someone's face if I don't believe. Or lips.
It's mainly the lips that you see.
Lips
that
and cheeks. As we have the history, over the years we had the high cheekbone, and now we have the big lips. Everyone's just having these big lips. It's probably, we blame the Kardashian, but to be honest, the Kardashian lips don't look as bad as what you see on the street.
No,
they still look natural.
Yes.
They're big, but they're natural.
Yes, yes.
I think what I always say, the end responsibility is on the practitioner. And I think, I'm not really sure why they do it.
Yeah.
One, they might not understand aesthetics. They do it because they only know how to do procedure. And when a client comes and says, I would like to have my lips done, they say, please hop on the bed, and they inject the filler like any other procedure. And they don't actually change the technique. They don't change the placement. They treat everyone the same. And they're doing it too frequently. So therefore, the end result ends up being exaggerated.
And they're not actually approaching it from a emotional, psychological perspective.
Exactly. Because
so it's a transaction.
Yes. Because what I found in the early days, I would treat someone's lips, and I do a lot of lips, but no one can tell that they've had their lips done. When you look at the lips that I've treated, they look subtle. They look enhanced, but they don't look done. Because you need to respect the different structures of the lips, because you can make something bigger, but you can still make it look natural and real. Yes. You preserve the light and the shadow, so it looks like it's never been touched, like God created this, not us. We haven't interfered. But when people come to see you after you do their lips, 2 months or so, they says, oh my God, I had so much compliment. Can I do it again?
Yes.
It's like, well, hang on a second. This is supposed to last 9 months. So what's the point of repeating it 2 months or 2 weeks later sometime? Because their friends stop saying compliment to them. So they're searching this reinforcement from their friends and family.
Yes.
And they come asking for more.
Yes.
Now, a practitioner's job to say, okay, let's go through the first consultation. This filler will last you 7 to 9 months. There is no need to repeat it because your lips are still looking great. The fact that your friends are not saying to you, oh my God, I love your lips, it's because they're used to you now. This is the norm.
Yes.
Okay.
Yes.
So you don't go and inflate them again, because if you inflate them, you ruin what you created in the first place.
It's a bit like a drug.
Well, it is because you get this positivity from people around you, because you get a lot of compliment. And let's face it, we love compliment.
Yes.
But what people don't know is when the compliments stop, how do I deal with that? So they're looking for something else because there's something else in their life not working well.
Yes.
And they're trying to put all their energy and all their, if you like, emphasis on, oh, this is the quick fix. Because yes, it is a quick fix. We can make someone look pretty good in no time. But it's not the solution. So you need to actually just go deeper into that person and try and understand, where is this coming from?
So it's a double-edged sword for
yes.
some.
But this is where I think I blame the practitioners, because they need to have that conversation, not take a shortcut and get them on the bed and then do the procedure and take their money and let the patient go out in the street looking ridiculous.
There seems to be a lot of new practitioners that have just come out of nowhere and have seen this area as an area where they can make a quick dollar.
Correct.
And it's really destructive, I think, and it doesn't honour the art, you know, of
it is because you're asking. Because I do training, I'm aware of really how many people can do it well and how many people have got no clue.
So, because you lecture, don't you?
I lecture around the world about this procedure, and I share my technique, because a lot of the technique I perform, I've actually come up with, because early in the days, there's not many doctors that could really just come up with ideas. I mean, the company will give you a product and say, this product does this, and it's up to you to do what you do with it. And then you come up with different technique, or where do you use it, and what do you do with it? So I'm one of the initial doctors that really started this industry. So we all contributed to really what the industry is like today.
Right.
But when these young people come to the industry, they come into it because it's a glamorous part. Let's face it. I mean, it's beauty. Yes. You know, we're making people happy all the time. And so it's glamorous. I mean, who doesn't want to work in an industry where you're beautiful? Unfortunately, a lot of these people that come into the industry, they're not artists. I mean, there's 10% probably that I'd say they got an artistic brain. The rest are really scientists. And you're sure they can give you a penicillin injection. But this is not about a penicillin injection. This is about creating a three-dimensional structure on your face.
Yes.
Now, if these people, they give them a piece of clay and say, hey, give me a square, they could not get it right. Give me a ball, roll it in your hand. They couldn't get it right. But then people are trusting these people to go and then create a very complex structure onto their face and make sure that it fits the size of their face and make sure it looks like it's not being done.
Yes.
And it makes them look better.
Yes.
This is a big ask. So it's not that probably, you know, they don't want to do it. The majority of them could not do it. And they're just doing it like a procedure. You know, you drop the price, and then you increase the number of people come to you. And then surely out of these people, some will accept the condition that you're under.
Yes.
So it's...
Yes. And unfortunately, this is something that happens throughout all capitalist societies, whether it's perfume that's copied or a Chanel suit or a Louis Vuitton bag. Eventually, there are people that'll come and say, let's just capitalize on this, make it, you know, cheaper, faster, lower quality.
Yes.
But who cares? Because we're bringing it to the masses. Everyone has a different philosophy, but it's lucky that
the bulk of it is really is just that the majority are not artists, and this is really what bothers me, because people are being taken down, and then they're being given the wrong procedures, they've been given the wrong product, they're being given the wrong outcome.
Yes.
Yeah. Without the public knowing that, you know, hey, this is not what I want.
Yes, yes. Dr. Joseph, I have learnt so much, and I know that our viewers would have learnt so much, and they're probably collecting their thoughts and trying to structure it. But I would really want to thank you, because I know you're super busy. allsaintsclinic.com.au. You have a number of clinics around the place, and also on Instagram, it's All Saints Clinic. Dr. Joseph, thank you so much. It's been a real pleasure.
Pleasure's mine. Thank you.